And the last little bit is environment. So here we are in peak hour Melbourne, and so in terms of environment, it matters in lots of ways. I'm just going to just emphasise a couple of general points and then one specific point. So it can mean a lot of different things. It means the air and the water and everything else that we do in the environment, but it also means home and friends, so having an environment that we feel comfortable in and feel at home in. Educational environment's really important for adolescent and childhood mental health. If they don't feel connected at school, then kids are much more likely to have various problems. And the urban environment, creating an environment that's healthy and inviting to get out and be active in, that makes us feel safe, is very important too. I mentioned before about sunlight, and because sunlight, we've got actually high levels of vitamin D deficiency in Australia now, which seems surprising because, as I was mentioning before, and inadequate vitamin D and inadequate sunlight is associated with a whole lot of problems, mental health problems included, but a whole lot of physical health problems as well. Put it the other way, it's the therapeutic effects of regular, moderate doses of sunlight. Getting out for that mid-morning walk or that late afternoon walk if it's in the summer months, or on the midday walk in the winter months, and getting some UV light on unprotected skin for 10-15 minutes is a really good policy on a regular basis. The more skin, the quicker you'll get the dose. So if you were going out, if it was a cool day, you may not want to, get out into your Speedos and walk around, but you might want to have short sleeves on. If you were going out for a walk after, say, I don't know, mid-morning or something, you might put some shorts on. I only mean that because you'll get the dose you need in a much shorter period of time. If we have very little skin exposed, then we only get quite a small dose in the same period of time. So it depends, it's a little bit of a balance as to how warm it is and how, how easy it is to get a certain amount of skin exposed. If you were going out for a bit of a swim in your lunchtime, for example, in the middle of the day, if it's the summer months, 10 minutes you'd have a massive dose of vitamin D. It'd do you easy for the day. If it's in the winter months, you'll get a lesser dose, but if you were swimming in a warm pool, for example, you'd get a pretty good dose then. Even if there was a little bit of overcast, you'll still get a pretty good dose. So we're not talking about sunbaking, and we're not talking at the same time about getting sunburn, but we do need regular moderate doses. It has an antidepressant effect, so it's a powerful antidepressant, particularly for those whose mental health issues are worse in the winter months. The seasonal affective disorder, virtually everybody gets a low mood. It's sort of like the brain's way of kind of hibernating. We actually need sunlight to keep us engaged.